My name is Katana Alcorn, and I'm doing a head-to-toe assessment on Shelly. Before she came into the room, we obtained her vital signs, height and weight, had her void and place on a gown. I washed my hands, and I ensured the room would be comfortable for her and private. So now we're going to begin with her skin. She is tan. There are no lesions present on arms or legs. Her skin is warm and dry. Turgor is greater than 2 seconds, or less than 2 seconds, I'm sorry. There is no edema noted. She has even hair distribution throughout her arms. Pulses are palpable, with the popliteal being 1+, posterior tibial and dorsus pedalis being 2+, and the brachial and radial were 2+ as well. I'm going to look at her nails. The nail beds are pink. There is no clubbing, no ridges or extra thickness. The refill is less than 3 seconds. She has no Broussard's nerves or Herbert's nodes noted. For her hair and scalp, hair is medium length, blonde in color. It's shiny and clean. It does have a coarse texture. There's an even distribution with no alopecia noted. The scalp moves well and is intact. Do you feel any tenderness?
No.
Her head is normal cephalic and atraumatic. No masses, deformities, or tenderness was noted on exam. For her face, there are no abnormal facial expressions noted. It's all symmetrical. Could you raise your eyebrows? Okay, close your eyes real tight. Okay, smile, frown, puff out your cheeks. Cranial nerve 7 is intact. Can you, with your eyes open, tell me if this is sharp or dull? Sharp. Dull. Close your eyes, please. Is this sharp or dull? Dull. Sharp. Okay, great. And clench your teeth. The motor and sensory nerves of her cranial nerves are intact. I'm sorry. Her eyes, there are no lesions. They extend to the outer. Her eyelashes extend to the outer canvas. Her eyelids are without lesions. There's no swelling. Can you raise your eyebrows again? Good. We're going to do a cover-uncover test. I'm going to cover my left eye. You cover your right. Right. Oh, that was your right. Sorry. Okay. We'll look at this. Look at each other's eyes and tell me when you can see my finger. Okay. Okay. And then we're going to do the other. Okay. Okay. And that is midway for the cover-uncover test. I'm going to look at your conjunctiva. I'm going to pull open your eye slightly. It is translucent to slight pink with no erythema noted bilaterally. Okay, for your lateral apparatus, I'm going to palpate around your eyes. There is no edema. Any tenderness?
No.
Okay. Now with the light, I'm going to look into your eyes. Her eyelids are hazel. Her irises are hazel. Her pupils are equal and reactive to the light. Can you follow my pen light? Convergence is present, so cranial nerves 3, 4, and 6 are intact. I'm going to look at her ears. They line up with the eyes, so they are not low sit. I'm going to tug on the auricles. Any pain?
No.
There's no pain, so she does pass the tug test. Have you ever been told you had any hearing trouble, or have you experienced any hearing difficulties?
No.
Okay, first I'm going to do the Weber test. I want you to tell me when you can no longer hear this.
Okay.
Okay. do the rhyme. When you can't hear it either ear.
Okay.
Oh, I'm sorry, let me repeat that. Let me know when you can't hear it in the right.
Okay.
And now?
Okay.
For the left. And bone conduction is greater than, or air conduction is greater than bone conduction. Cranial nerve 8 is intact. I'm going to look in your ears now. The canal is pink with no redness noted. Tympanic membrane is a pearly white with no bulging noted. The canal is slightly pink, no irritation noted. She does have a little cerumen in this ear. The tympanic membrane is pearly white, no bulging noted. Now for your nose, her nose is symmetrical. There are no lesions to it. Any tenderness? No. Any tenderness in your sinuses? No. What about up here? No. Okay, great. And that's all normal. I'm going to have you cover one nostril and breathe. You can breathe. And the other nostril. Good. And take a breath. No, just all at once. Is it? Her nostril is patent. I'm going to look it in through her nostril. Okay. No masses. The turbinates are slightly reddened. It's good and patent. I'm going to move to her mouth. Her lips are without lesions or lumps. Can you open your mouth? I'm going to, you say ah? Okay, good. I'm going to test, her mouth is without redness or lesions. There is no inflammation on her Wharton's duct or Stinson duct. Can you open and stick out your tongue? Lift your tongue up. Good. All of her teeth are intact and in place. There are a few fillings noted throughout. Can you stick out your tongue and move it from side to side? There's no lesions on her tongues or lumps. Okay, I'm going to do your gag reflex. Okay, gag reflex is intact. Her uvula raises midline. So cranial nerves 9 and 10 are intact. Upon viewing the inside of her mouth, her soft and hard palate are intact, as well as no redness to her mucosal mucosa. Her tonsils are visible, but there's no edema noted. Okay, for your neck. Her neck is symmetrical on both sides with no lesions. The trachea is midline. I'm going to fill her lymph nodes where you have the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, posterior superficial nodes, deep cervical chain, supraclavicular, her epitrochial. I'm going to fill her axillary. There's no tenderness noted, correct? Okay, and none of them are palpable. Good. Now I'm going to do your throat. There's no, her thyroid is midline. There's no goiter or enlargement noted. Any tenderness?
No.
Could you please swallow? Good. I'm going to listen over her thyroid. And now I'm going to palpate her carotids one at a time. Her good 2+ pulsations with a good upstroke, and I will listen to those for bruits with the bell and my stethoscope. And then noted, that is good. Okay. Can you move your head to this side against my hand? Good. And the other? Good. And shrug your shoulders. Good. Range of motion is intact there. Can you touch your chin? Look side to side. Good. And put your ear to your shoulder on both sides. And no pain on that. Good range of motion noted. We're going to look at your chest. There are no lesions or scars on her chest. Her respirations are even in labor. There's no distress or accessory muscle movement. Sorry. On her lower chest. You take a deep breath. Chest wall expansion is symmetrical. The anterior to posterior diameter is less than the lateral, so there is no barrel chest noted. I'm going to palpate your chest. Tell me if you feel any tenderness. No tenderness? Good. Now we're going to check for tactile fremitus. Can you say 99?
99, 99, 99.
Okay, and that is intact and equal bilaterally. I'm going to listen to her breath sounds. Just breathe normal. Now since I have my stethoscope, I'm going to go ahead and listen to your heart sounds. I'm going to start with the aortic, pulmonic, Erb's point, tricuspid, the mitral valve. Okay. There were no extra heart sounds heard. I was able to hear S1 and S2 very clearly, and no S3 or S4 were noted. I'm going to check for aortic regurgitation. Could you lean forward slightly? And no aortic regurgitation has been heard. So I'm going to move to the posterior chest. I'm going to assess your back. There is no lesions. Skin is warm and dry. Everything is intact. Throughout her spine, she does have the normal curvature noted. I'm going to palpate for tenderness. Let me know if you have any pain.
No pain.
Okay, good. Still no discomfort?
No.
Okay. Can you take a deep breath for me? And she does have symmetrical expansion on her breath this way too. I will percuss between her inner space for good resonance. Sorry. And I'm going to auscultate her breath sounds. Deep breath, please. Deep breath. Okay. 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 I was able to hear clear vesicular breath sounds throughout the posterior chest. I'm going to move to the anterior chest. For this, I'm going to go ahead and have you lay down. I will grab a extra sheet to keep you comfortable and ensure your privacy. So, stomach up. On your back. There we go. And we will start with palpating for thrills and heaves, and for even exploration, just take a big breath in and out. Good. I'm going to auscultate. Again with her laying down. Aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to do this also with the bell to detect any murmurs. Okay. And all the sounds are within normal, no murmurs were noted. I'm going to take a look at her abdomen. Have my flashlight. I have her covered. First I'm going to inspect the skin. The flashlight, there are no heaves or pulsations across. There is strom striae noted and about a 6 millimeter or 6 centimeter, posterior umbilici scar from a cesarean section, actually 4 cesarean sections, beginning in 1998 with her first. Other than that, the skin is intact and without any lesions. Can you sit up? Just slightly, okay. No umbilical hernia is noted. I'm going to listen to her bowel sounds. Bowel sounds are active and present in all 4 quadrants. I'm going to go ahead and listen for bruits with the bell of the stethoscope to the abdominal aorta, renal aorta, renal, iliac, and femoral. No bruits noted. I'm going to percuss for tympani, down her midclavicular line. Good. Now I'm going to percuss for liver span. And it does come about 6 centimeters from resonance to dullness. I'm going to palpate that now. Okay. The edges or the liver border is smooth and it is soft. There are no ridges noted. I will go ahead and percuss on the left side for splenic dullness. see if I can palpate the spleen, which is I'm not able to. I'm now going to try and capture a kidney, which I am unable to do. Now I'm going to lightly palpate for abdominal tenderness or enlarged organs. Then I will move to a deeper palpation for the same tenderness or enlarged organs. Do you have any tenderness?
No.
Good. I'm going to move and let you sit up. Can you bring your legs to this side and I will hold this to keep you covered? Right now, just trying to ensure that my patient has complete privacy and comfort in the room. I'm going to look at her legs, which any pain or tenderness on her kneecaps, no. There's even hair distribution, no lesions or discolorations. She's got 2+ pulses on her posterior tibial and dorsus pedalis. There's no edema noted throughout. The skin is warm and dry. I am going to check her reflexes. Good. There we go. Good. Can you pull up against my feet, please? Good. Push down. Do you have any pain when you do this? When you bring your toes up to your calves? That's a negative Homan sign. We are going to assess, have her stand up, and I'm going to look at the curvature in her back, and then I'm going to check her gait. So for the curvature in your back, we'll just keep you covered till you stand, and I'll give you that second gown to keep you covered. Good. Can you bend straight over and touch your toes? Good. And her she has a good curvature, no scoliosis. Okay. I'm going to tie this again and give you another. Are you able to stand on one foot? Go ahead, stand on the other. She has good balance. Can you walk straight? If you turn, can you walk heel to toe? She has a very steady gait and good balance. We're going to check a little bit of range of motion. Can you twist to both sides? Any pain or discomfort? No. She was able to touch her toes without difficulty. Can you raise your arms up? Okay. Try and push. Don't let me push down. Good. Don't let me push up. Good. And try the empty in the cup. And see if there's any discomfort when I push down. Empty your cup. And discomfort? No. Okay, are you able to flex completely backwards? Okay. Go from down here to straight up over your head. And out. And no pain?
No.
Good. We're going to check for the Fallon test for carpal tunnel at 99. Any discomfort?
No.
Okay. And this ends my head to toe assessment on Shelley. Thank you.